Welcome to the First Responder and Care Partners training on how to work together in urgent situations for people living with dementia. This training will mutually benefit first responders and caregivers by offering dementia education, communication tips, critical thinking strategies, and ways that families can be prepared when crisis situations occur. Before we get into the training, let's discuss the reality of dementia. According to the World Health Organization, as of 2019, there were 50 million people living with a form of dementia globally. This number is projected to increase to 82 million in 2030 and to 152 million in 2050. When responding to a 911 call, the odds are it will be for one of the more common medical problems such as infection, dehydration, a fall, a heart-related issue, or a change in cognitive status. The Alzheimer's Association in 2020 reports that people with a form of dementia have twice as many hospital stays per year as other older people. Wandering away from home is a common symptom a person with dementia may exhibit. Law enforcement and all first responders work closely with organizations committed to keeping this vulnerable population safe. A few of these programs include the Silver Alert, the Safe Return Program, Medic Alert, Project Lifesaver, and the Scent Evidence Canine. Go to their websites and see how they're helping with ways to safely return a person that has gone missing. Now let's understand dementia and the associated behaviors. Behaviors emerge as a response from an unmet need, disease process, or a coexisting medical illness. Many of the observed behaviors include memory loss, impaired thinking, impaired reasoning, an untidy appearance, confusion, wandering, impaired language, repetition of statements, mood swings such as irritability or agitation, and paranoid thoughts. Before we discuss the overall behaviors, let's discuss dementia. Aging does not mean a person will get dementia. As we age, the size of our brain and chemical productions within the brain change. This may cause mild delays in thinking, so it may take longer to retrieve a thought, remember where we put something, or to learn a new activity. Dementia is a group of conditions that impair one's thinking, communication, function, and personality. These changes may require this person to need assistance in daily life. There are many types of dementia, with Alzheimer's disease being the most common. The brain affected with dementia is compromised. For example, with Alzheimer's disease, there are abnormal proteins that build up and in between nerve cells in the brain that ultimately destroy it. These cells are necessary for healthy communication. Without efficient internal messaging, the brain cannot communicate to its counterparts, so memory, communication, and functioning are all affected. These changes make it difficult for people to solve problems or understand what is being said to them. Therefore, when interacting with them, you will need to be patient and understanding. Take note to the left side of the screen comparing the healthy brain and the advanced Alzheimer's brain. Notice the appearance of shrinking in the affected brain. These are the effects of the proteins building up and in between nerve cells in the brain that we previously discussed. The person living with a form of dementia will not have a bandage on their head or a cast on their arm, or wear a sign that says, "I have a disease that affects how my brain interprets the world around me." The thing is, not all disabilities are visible. Knowing that the brain is responsible for all of our cognitive and physical functioning, it is easier to recognize how a specific behavior may emerge. The person that is confused and disoriented has lost the ability to track time. Impaired thinking and reasoning may affect their appearance or mood. The person with dementia interprets the world around them differently. Both vision and hearing are affected. They tend to lose their peripheral vision, seeing only what is before them, so if a person approaches them from the side, it may startle them. Sound may be perceived as distorted or amplified, which can be disorienting. These changes to vision and hearing may emerge as agitation. When memory, reasoning, and communication are altered, a person may forget where they put something or may not understand general conversation. This can lead to paranoid thoughts. Wandering is when a person walks and we don't understand their purpose. The Alzheimer's Association estimates that 6 out of 10 people diagnosed with dementia will wander at least one time. The focus of this training is to help the first responder and the care partner understand dementia and recognize how we engage with them may help reduce some of these behaviors. Now that we understand dementia and associated behaviors, let's discuss how to effectively communicate. We express ourselves using verbal and nonverbal communication. The spoken word, our body language, and the tone of our voice conveys the total message. It is important to have them match so you do not confuse the person with dementia. They rely on nonverbal cues when processing a message. It can take a person with dementia up to 90 seconds to process what is being said, so take your time with them. Verbal communication is how we convey our message with words. Understanding that a person with dementia receives and processes language with difficulty is the first step towards improving overall communication. Effective verbal communication tips include: be concise and speak slowly, or the message might get lost. Be patient and wait for them to respond. If they do not understand the statement or question, rephrase it rather than repeat it. Always be positive, friendly, and reassuring. This creates trust. It's important to never challenge a person's reality. This may escalate their frustration. Always engage with them in a way that builds trust by first making eye contact at their eye level and introducing yourself. Let them know who you are and what you are doing. For example, "Hello, my name is Justin. I'm a police officer. I am here to help you." Nonverbal communication is a way of expressing yourself without words. Different ways to communicate nonverbally are facial expressions, posture, eye contact, gesturing, and personal space. Here are some examples. Facial expression is understood by reading a person's face. A smile can convey you are happy, friendly, reassuring, and trustworthy. Posture is how a person carries themselves. If you stand tall, shoulders back, arms open, it conveys that you are confident and welcoming. Eye contact. If you put yourself at their eye level and make eye contact, it can create trust. If someone is in a wheelchair or seated, it can be less threatening than standing over the person. Gesture. If language is lost on a person, a gesture can help with the translation. A thumbs up tells the person, "Good job." Personal space. Standing too close to someone can feel threatening. Consider the space between you and the person with dementia when engaging with them. Remember, be sensitive to all cultural background when using nonverbal communication. For example, eye contact can vary culturally and be considered confrontational or aggressive instead of a sign of respect. When communicating with a person with dementia, it is helpful to meet them where they are. Use empathy to try and understand their thoughts and feelings and respond accordingly. This approach enables you to engage in a compassionate and supportive way. There is no judgment or lie in this technique. Here is a scenario for the care partner. You are your mother's caregiver. She is upset and demanding that you let her go home, even though she is currently residing with you. Using the empathic response, ask her where her home is. She may respond with an address or a city where she lived when you were growing up. This is because this is the current time frame she believes it is. With dementia, there is a disorientation of time, so she believes in this moment that she is younger and raising her family. Use this moment to talk about the home while you distract her with something she enjoys. Here's the key takeaway. Find the trigger word, in this case home. Do not be challenging, stay patient, be friendly, and allow her this moment. Engage her in this memory while diffusing the intensifying situation. Therapeutic fibbing is a technique that relies on the use of mild deception or distraction to diffuse a potential situation of anxiety, sadness, or danger. It can help reduce agitation or improve cooperation in a crisis situation. For example, imagine there is a fire in the home and the person with dementia will not leave despite attempts. It would be appropriate to tell them that you are taking them to speak with their daughter. This is a mild deception. The daughter is not at the home, but you can call the daughter when you are at a safe location. This approach could de-escalate a potentially dangerous outcome. Let's recap the importance of communicating and how it can help to stabilize or de-escalate a situation with someone diagnosed with dementia. Here's a best practice. Establish trust with communication. Ensure verbal and nonverbal communication match. Do not challenge. Using an empathic approach can help stabilize a situation by meeting them where they are in their reality. If this technique does not appear to be calming them down, use therapeutic fibbing to help de-escalate. This approach is used not to correct their misconception, however, but to reduce their unrest or sadness or lead them away from a crisis situation only. Now that we have discussed dementia, behaviors, communication, and techniques used to both stabilize and de-escalate potential situations, let's talk about what the person with dementia and what the care partner go through in a day. This will help add perspective to each. A day in the life of someone with dementia. Routine and structure are comforting to a person diagnosed with dementia. As the disease progresses, planning and organization may be impaired. They will rely on habits for all activities. Changing their routine can disrupt their behavior. Remember that a person with dementia has an altered perception with vision and sound, so they may exhibit some behaviors as a result of these differences. By understanding these changes, as well as the disease process, it will be easier to alter personal interactions or the environment to decrease potential emerging behaviors before they appear. Care partners are invaluable, and 48% of them are family, friends, and community volunteers that are unpaid. 34% are age 65 or older, and 30 to 40% report that they have depression. The responsibilities of caring for someone with dementia can last 5 or more years. The day in the life of a care partner involves high levels of emotional and physical stress. They take care of all self-care needs, including daily tasks such as meal planning, finances, and laundry. They manage all medical and health conditions while offering companionship and emotional support. They do all of this while navigating the potential behaviors associated with dementia, including confusion, distraction, safety, and reasoning skills. Many care partners also admit they don't sleep well. Despite all of this responsibility, many agree that it is extremely rewarding for them. A person with dementia misinterprets the world around them, creating a greater risk for dangerous situations. Think about simple changes you can make in the home to reduce potential emergencies. For example, if cleaning supplies are stored next to food, the person may accidentally drink it. Noisy environments create anxiety and possible agitation. Consider changing the locks or simply hang a curtain over the door to reduce the risk of someone wandering away from home. You could also place an alarm that rings every time a door or window is opened to alert you. Here are some key points for care partners. A care partner can reduce some of their guilt and sadness by first acknowledging that behaviors noted in the person they care for are not their fault. Self-care matters. Take care of yourself, find a local support group, and find time to take a break each day. Now that you know what potential triggers can incite a behavior, you can modify your interaction and make simple changes in the home to decrease them. Pay attention to routine, noise levels, communication, and adjust if needed. Using this training may help to minimize stressors in a potential 911 situation. However, this does not remove the possibility that an emergency may happen. When it does, it's important to be prepared. Create an action plan. If 911 is needed, the care provider can help ease the process by remaining calm and being prepared. When calling 911, identify the emergency and notify them there is a person with dementia that is involved. Describe their behavior to the dispatcher so the first responder can adjust their approach. Report any significant health issues such as diabetic or heart condition. This information is useful for the first responder. If safe, remove distractions within the environment. Turn off the TV or radio and close windows to keep them calm until help arrives. When the first responder arrives, be prepared with a medical sheet with all necessary information to give them. This sheet would have everything the first responder would need to make the visit as seamless as possible. Here are some things to include: a copy of all current medications, a timeline of change of behavior or symptoms to establish both baseline and severity, copy of medical insurance card, a list of all healthcare providers with phone numbers, medical history, list of all allergies, and a stress-reducing method, such as the name of a family member, pet, or favorite music. Consider the acronym REACH when responding to calls. R. Risk perception. Consider the overall risk to self or others from low to high. E. Establish trust. Make eye contact at their level. Introduce yourself. Let them know you are there to help them. The person with dementia will feed off your energy, so be positive, calm, pleasant, and reassuring. Remember that the way you communicate can build trust. A. Assess needs. Evaluate for community needs and allocate appropriately. C. Calm environment. Consider the environment and monitor for distractions. H. Healthy partnerships. By utilizing the REACH acronym, you are bridging the gap for first responders and care partners for a person with dementia. This last part of the training will lead you through 2 scenarios for the first responder using the REACH acronym to critically approach a response call. We will also offer some community outreach ideas. Let's take a look at this first scenario for first responders. A 911 call is received, a gas leak in an apartment building. What would be the best practice to lead them to safety? You arrive on the scene, and a man is very upset, asking you to help. He states his neighbors won't leave their apartment. He tells you they are an elderly couple, and the husband refused to leave, and the wife will not leave him, despite his desperate plea. They are on the 3rd floor, apartment 312. Think of the acronym REACH. Risk assessment. You know that you will have to evacuate the husband and wife, as the gas leak is a dangerous situation. You also know that they are an elderly couple, and the wife will not leave the husband. When you enter the apartment, the wife is upset and telling you she cannot get her husband to leave. She tells you he is confused, cannot be left alone, and that she takes care of him. Ask her if there is a family member that he looks forward to seeing. The wife responds, his daughter Kathy. Establish trust. Using positive energy, you approach the husband. Make eye contact, introduce yourself, and let him know there is a gas leak in the building and everyone needs to leave. Remembering to not challenge, consider using the therapeutic fibbing technique. In a pleasant, slow, and friendly manner, tell him you will take him outside to speak with Kathy. Offer your hand and lead him out. Have the wife bring a cell phone and call Kathy from a safe location. Assess needs. After you have safely evacuated them from the apartment and handled the gas leak, recommend community resources that may be helpful for the care partner going forward. Calm environment. Lead them away from the building to a quieter area while they wait for the gas leak to be contained. Let them know you will find them and tell them when they can safely return. Healthy partnerships. We are all in this together, and by approaching the situation using REACH, you handled it in a manner that de-escalated a dangerous situation. Now let's take a look at our second scenario for first responders. You receive a call that there is an older woman walking on the side of the road in a busy street in her nightclothes. She appears confused and lost. What would be the best practice in this situation? Risk assessment. From the call, we know that this is an older woman that is confused. It is 2 p.m., yet she is wearing her nightclothes. This is a potentially dangerous situation as she is walking on a busy road. Establish trust. You need to find out the woman's name and where she lives. She needs to trust you. Approach her from the front, make eye contact, let her know your name, and you are there to help her. In a pleasant, calm, and friendly voice, ask her name as you lead her to a safer place away from traffic. She knows her name. Now ask where she lives. She says, "Over there, I live over there." Ask her if she has a bracelet. Always look for a medical ID bracelet. In this instance, there is no bracelet. You notice she is carrying a purse. Ask her if she has identification. She says yes and hands you a card. It's a driver's license. You notice that she lives nearby. Ask her if she has any family that live here. She gives the name of a son. Ask if she has his number. She reaches in her bag and pulls out a card. It has the son's name and phone number on it. Contact the son and explain that you are with his mom, where you are, and ask him to come pick her up and take her home. Stay with her until the son arrives. Assess needs. Speak with the son when he arrives and direct him to resources that would be helpful, like the local memory disorder clinic that can provide a comprehensive diagnostic and referral services for a person with Alzheimer's disease and related dementia. Document the event. Complete type of report based on your agency's policy. Calm environment. You led the woman away from the noisy and crowded environment to a quieter area where she would be less distracted. Healthy partnerships. Using REACH, you stabilized a potentially dangerous situation and safely resolved it. When a call is dispatched to a situation for a person with dementia, it is necessary to file a report even if there is no charge. Proper documentation allows all first responders to have access in an emergency situation or in future incidents. Law enforcement officials should also work with their local memory disorder clinic to ensure families needing Silver Alert support are linked with the resources they need to prevent future potentially dangerous instances of wandering. Let's wrap up this training by taking a look at some of the resources and support that are available. Your region's area agency on aging is your starting point for finding aging, disability, and caregiver resources. These resources can be government-funded, nonprofit services, or even private pay options. Their goal is to help connect you with the support you need to live safely and independently. Contact their Elder Helpline at 1-800-96-ELDER. Community resources are crucial to support families. As first responders, you can initiate this conversation by educating the families on agencies that can help. The Department of Elder Affairs, North Florida Area Agency on Aging, Advantage Aging Solutions, local memory disorder clinics, the Alzheimer's Project, and the Alzheimer's Association are just a few of those resources. This training is brought to you by the Florida State University College of Medicine Department of Geriatrics REACH program, Aging Advocate, the Florida Department of Elder Affairs, Dementia Care and Cure Initiatives, and Big Bend Task Force. Please visit our website at reach.med.fsu.edu to get more information regarding all programs, agencies, and community resources discussed in this video.